So, David, did you know that 2022 is the year of the tiger?
I actually did know that. Yeah,
So, it seems like next year could be a pretty ferocious year on several fronts. So, maybe we spend a few minutes talking about that.
that would be great.
There have been a lot of recent sort of elections, and I'm just curious as to how you're reading the tea leaves in terms of how those elections are going to impact, the November of this year, but certainly next year.
Yeah, I think there's a lot to look at in there, and I know you and I have been talking about it. In the last couple of weeks, we've had one primary in Texas, in which the candidates that were selected and endorsed by former President Trump did not win the Republican nominations, and then in Ohio, we had two special primaries to fill two House seats. One of them in a very red, very stronghold GOP county, and that one with a large number of candidates. The Trump candidate did make it out and did succeed. The other one in Ohio was a very, very much more liberal and Democratic stronghold, and there was a lot of attention from one candidate that was sought to lead, and that was the one that Senator Bernie Sanders and Congresswoman Alexandria Ocasio-Cortez were backing. And that person actually did not win the nomination. It was won by someone who was backed by Congressman Jim Clyburn and Hillary Clinton. So we're beginning to see where some of the older, more established battles are going to be fought, and how how Democrats are thinking about what they want to do, since they think they're going to be facing Trump and Trump endorsed candidates in 2022, and of course possibly in 2024.
Yeah, in terms of that third race that you mentioned, I know that district pretty well because it's northeastern Ohio, and traditionally that's been a real sort of labor stronghold. So it's interesting that it went kind of for a more moderate Democrat. What's your sense as to why that happened?
When it comes to labor issues, I mean, there is a longer standing relationship between labor and the more traditional Democratic Party. And I'm not saying that's not changing for the future. I'm just saying that there are things that could have affected that. I mean, we're going to have to see whether that particular district was really a forebearer of things to come or not, or if it was an outlier.
And how do you explain the split in terms of the two candidates that were backed by the former president?
I think more traditional Republicans in Texas kind of came out. I also think that the panel in Ohio was rather broad, and it gave Trump's endorsement a lot of edge, and also the Trump organization did take some of those millions of dollars that we've heard talked about, and pumped some of them into, I think, about $350,000 digital ad buy right at the end. That could have also pushed him over.
Yeah, I think the other issue, I know I'm bouncing back and forth, but if I sort of circle back to the Democrats, I think the other thing that's likely to split the Democratic Party in terms of these, sort of a moderate wing and a more liberal wing is sort of what happens with Supreme Court Justice Breyer, and the fact that there is some discussion around, encouraging him to step down sooner rather than later. And I'm curious as to how you think that's going to sort of impact some of the races in 2022.
That would be a wild card, in my opinion, because there would be a lot of pressure on President Biden to deliver to some of those real core constituencies that helped put him over the edge in places like Georgia. And so I think there'd be a lot of pressure for a woman of color, and there's a whole lot there, and of course, as always, Republicans like to use Supreme Court nominations, as do Democrats, as a rallying call for fundraising, and anyone that they can paint as liberal going onto the court would provide them a pretty robust red meat agenda upon which to raise money.
So just sort of shifting gears a little bit as we're kind of within this theme of 2022, one of the other issues, and it's funny, it's something that I hadn't appreciated as a political issue until during the Obama presidency when Lawrence O'Donnell, who was a former staff member for Senator Moynihan from New York, and then now is, of course, well known in media, both for his work on the West Wing, but also on CNBC, had raised the issue about the debt ceiling and sort of how that's become politicized. How does that play into all this?
I'm glad you asked that, because for our listeners, I think that's a real good, if you want to find kind of a particularly unique thing to watch over the next couple of months, I think debt ceiling is going to be really interesting. The debt ceiling did expire on August 1st, the ability to finance more than what we have already approved. Fed Chair Janet Yellen had talked about using some particular techniques for allowing a bit more borrowing and some moving of money about. But the reality is that at some point this fall, after September, they're going to have to deal with the debt limit, and that ceiling is going to make Democrats, I think, probably right now, Republicans seem more unified over requiring cuts. I think that actually is going to be a really useful exercise for Democrats, because they're going to have to really come to an agreement on what they're going to fight for in social spending for 2022. And so I think you'll see some of those issues really playing out in how the debt ceiling is dealt with. And it's a kind of a behind the scenes and the dark tea room type of politics to look at, but the debt ceiling, I think, is going to tell you a lot about which issues the Democrats are going to go to the mat for.
And what's your prediction in terms of the issues that they're going to go to the mat for?
Well, part of that is going to depend on whether there is an infrastructure deal, and whether the infrastructure deal is also one that's done in reconciliation, which allows them to put a lot more money in than the bipartisan infrastructure deal. And so that's going to influence a lot of some of the other special things that you're going to want to see, and particularly protecting expansions in the Affordable Care Act and what they've offered, particularly guarantees for children and family health care issues and insurance. But at the moment, I think you're probably going to see some real bread and butter issues around like how much gets taken care of in infrastructure and how much doesn't. So if you get a lot of things that are just, pick and shovel in the infrastructure bill package, just like bridges and roads, that's one thing. But a lot of the other things that they want to see offset, including things like telehealth and the digital divide and those issues that I think are very important to them, they're going to be really interesting to play out. And as always, one of them that's not a financial issue, but it's truly playing out as a big deal, is those bills introduced in state legislatures around curtailing voting access. And that's going to really be on their minds a whole lot.
Yeah, so before we talk about the voting issues, I guess if we sort of take a step back and think about the potential relationship between the debt ceiling and then infrastructure, the way you described infrastructure kind of falls into three broad categories. So there's kind of traditional infrastructure, roads, bridges, other sort of transportation-related structural issues, as well as 5G, and that's in the sort of bipartisan package. And it seems like there's Senate support for that, and the question is, would the House support kind of that very focused piece? Then the second element's what I would describe as human infrastructure, so the ACA, health, children's health care, some of the telehealth issues, et cetera. And then there's a third piece, which you didn't mention as much, which is kind of some of the priorities around climate change and what you would have to do with infrastructure to address climate change. My read, and I'm curious if you agree, is that it's likely the traditional infrastructure, that the Senate sort of compromise package will get finalized and will be approved by the Senate and the House and then the President. Then the big discussion becomes around this human infrastructure, and that may or may not go forward in some capacity, but probably would. And then it seems like what would be lost then would be the climate change piece. I'm just curious if that's your read as well.
I think it's at risk, but I think it's a very, very, very high gamble risk. I think that losing climate change, any real movement of climate change, could really risk young voters in 2022 for the Democratic Party. So I didn't go into it too much because I was just we got some other things to talk about today. But that is definitely a very high gamble for them to play. I think they're going to want to figure out how to get that one worked in as well. And I think Nancy Pelosi is going to really be the one pushing that.
Yeah, no, I think it gets really, it does. It's an interesting topic. And, there is obviously several connections to our membership and to the focus of nephrologists. And one of the issues I've thought a lot about is just, the fact that dialysis is so dependent on water. And does it, in my mind, you have to have that conversation.
True. It is very emblematic of that. Let's talk about that some. Let's talk about what we're seeing there in 2022.
Okay. So as if we sort of end really being very focused on both the sort of dialysis environment, I'm also curious about what's happening with COVID-19, with vaccines, with potential reporting on vaccines as you look to next year.
Yeah, I think the government is going to definitely has already started to show its hand in the regulations that really deal with nephrologists, usually the ESRD program and its requirements, PPS, QIP, and the physician fee schedule. There's been some requests from the government, from Medicare, to have comments about whether or not they should institute metrics around vaccination rates. And so they're inviting comment. However, in the past couple of weeks, I think they've already kind of given us their answer. I think it's already determined. There are a couple really important rules that have already been finalized that kind of show where they're going, and those rules are mainly the inpatient prospective payment systems and the outpatient prospective payment systems, and also the prospective payment systems for skilled nursing facilities. And consistently across those three rules, when they've been finalized, Medicare has already decided that in 2022, we will have reporting requirements for healthcare professionals and vaccination rates. At the moment, that is not going to be something that's translated into payment or penalties. It is going to be what we call a process or a reporting metric. But it's still going to be public, and it's still going to affect ratings. It's going to be shared with, it will be reported to Care Compare. So people will see it, and they will know kind of what those rates are. And that's going to be happening across Medicare and medicine. And I imagine that it's not going to go away anytime soon. I don't think that they're going to require it with patients yet. But even though we're still set to comment on what they're asked us about in the ESRD benefit package, the truth of the matter is they've already set these rules out in these other rules, set out the regulation, and so it will be consistent. So we know that we're going to have to deal with reporting on vaccination rates among healthcare professionals, and that will really hit both in hospitals and in dialysis facilities, clearly. And there's some concern about what that will mean. And as you know, our members have been really engaged with a very full-throated conversation about what happens at some point. Do you have to require, do you make vaccination mandatory to work in the facility? And that's a big question. And ASN's actually said something about that.
Yeah, no, I appreciate your sort of circling it back to ASN, because we were part of a joint letter. Zeke Emanuel from the University of Pennsylvania had led a sort of coalition effort that included ASN, other members of the Council of Medical Specialty Societies, and other sort of key organizations around requiring healthcare, or recommending that healthcare professionals be required to mask in healthcare settings. So I do think, as the Delta variant has started to spike, or as the Delta variant has increased across the United States, there's a lot of interest in this discussion. And it's just amazing to me that already we're thinking about 2022 and, some of those issues.
It is correct. We are looking at that in 2022. COVID-19 is shaping everything that they're doing for 2022, quite frankly. And I just wanted our listeners to know that with what you were just talking about in terms of ASN signing under that letter, supporting, healthcare providers actually requiring the healthcare professionals and employees to be vaccinated, that has been that is not without concern. And particularly the chief medical officers around the country have really been very vocal about their concern in some places that there are people who will not continue to work in a dialysis facility if they're required. And those generally are correlating with places that are also really facing shortages, staffing shortages, and that's going to be hard. So there's a lot to think about there. But the whole ESRD QUIP program that our members are knowing so well has pretty much for 2022 been turned into a reporting only program, I think with one exception. So most everything in terms of its penalties are actually going to be just neutralized into simply reporting elements for 2022. So we'll see how that goes.
Well, thanks, David. Why don't we go ahead and end there? We've covered a lot of ground. I think we've illustrated why 2022 is going to be the year of the tiger, and we can still maybe next time circle back to the rest of this year and some of the what's likely to happen over the next couple of months, both in Congress, but also the White House and the regulatory branches.
I look forward to that conversation.